Guys, today it's a beautiful day in Berkeley, so it's time to switch to a new topic. We've been talking about sunset law and estate planning. Today we're gonna touch on a new topic that's basically we recently have like a national wake-up call by the assassination of a late United Healthcare UHC CEO Brian Thompson. Um, that is really so far I've seen uh, quite a few reports, but I think the best one I think it's from the Fortune magazine. It's written by Erica Fry, an interesting last name. So here, she gives us more background information and also a big picture view, and also with some details. So it's a nice combination of uh, macro and the micro views. Let's get some numbers first. It's interesting that it's a election year. This year is 2024, but you don't hear much talking about the healthcare, even during the election. So there's some couple reasons. One possibility could be that there's not much talked about. The second possibility may be people mostly happy with this system. There's some surveys to supporting that. I think there's a survey by KPP. I forgot it's a KPP or KFF. I think it's KFF is specialized in the healthcare industry surveys, and then they constantly doing the surveys and polls and things like that. So last time we checked that 81% of respondents either believe that the healthcare system is excellent or good. Okay. Funnily, interestingly, that 6 out of 10 of people had some encountered some problem with the healthcare system. So I guess that could means that those problem has been solved to their satisfaction. That's one possibility. Okay, and so that's kind of interesting. So, but here, let's look at the industry. The first thing is the size. Do you know that I didn't know that until Erica Fry told me that the healthcare industries, including healthcare insurance, they are 8 out of 25 largest company in this country. Their revenue, their GDP, it's about 17% of the national GDP in the U.S. Okay, and so this is a huge size. The entire sector is $1 trillion business. It's a $4.5 trillion for the healthcare industry. Okay, of this industry, the United Health Group. There's two things. One is United Health Group. Another is the United Health Care. So we call them UHG for United Health Group or UHC for United Health Care. United Health Care is a subsidiary of the United Health Group, UHG. Okay, and then but you can see this is the biggest. When in 2023, UHG getting $371 billion in revenue. Okay, of this $371 billion, $281 billion is from UHC. So UHC is basically the cash cow of the UHG. No wonder that the UHC boss, the president, Andrew Wett, I believe that's his name. He published an article in New York Times, I believe, and he was saying that Brian Thompson is a nice guy. I miss him. He will be missing. He will be missed because he's so far he's bring a huge amount of money into the UHG. Okay, To put this into perspective, the revenue into perspective, I believe I was reading for something the other day that Louis Vuitton LVMH, the biggest conglomerate in France, their revenue is about the same as the UHG, yeah, because the whole group. The whole group is the number four biggest company in the country, number nine biggest companies in the world. Okay, and again, that if you take that the US United Healthcare, that insurance branch of a UHG into account, then that company, it's basically, if it were a standalone company, that would be number nine biggest company in this US. Okay. The other interesting fact is that, even though UHC and UHG are huge, big company, conglomerate, but their profit margin is actually pretty low. It mainly win by the size. Okay, it's like a supermarket. Supermarket, the profit margin is not a. It's like a 2%, 3%, 4%, right? Same thing for the healthcare. Although having said that, UHC, the United Healthcare, profit margin is probably the biggest in the industry, about a 6%. The other guys like a 2%, 3%, But on the other hand, if you look at the different industry, high tech industry, the routinely it's not unusual to hear like Apple's, Google's, and then you know Microsoft. Those guys they can routinely get it like 20 to 40% of the profit margin. So this is you can see the what kind of a game is playing. These guys in the healthcare industry, they are playing the numbers game. Of course, the other guys are playing numbers game, but this is specifically for the healthcare industry. That's why I believe that later, when if I get a chance, that I will talk about that. Congress really should do something because Congress have to serve the biggest number of citizens and residents in this country. We should have done something different. Okay, not just a numbers game, but also you have to specifically understand why, how the UHC. We're talking about United Healthcare, that insurance branch of a United Health Group. What kind of game they're playing? They basically do two things. Number one, it's a huge in vertical integration. In business, we have two integration. One is a vertical, another is a horizontal. If a car dealer, if a car manufacturing uh, get some, integrate some battery companies, then that basically that integrating, you're going down to the supply chain or value chain, right? But if one car manufacturing integrate or acquire another car industry that's a vertical, that's horizontal integration. So UHC has done an excellent job in doing the integrating, vertical integration. If we can look at some numbers, look at some fact that before like 2010, like in Obama's care law signed into the law, and then UHC is only like $87 billion. Okay, now we're talking about 2023 is 281 billion dollars. It almost like increased by $200 billion. That reveals that how big a game is that they are playing the vertical integration. By that we can let's look at some fact that the UHC has the biggest pharmacy supply chain and the biggest physicians group in this country and a whole bunch of others. But then the other thing is that it really benefited from Obamacare. Okay, Obamacare, I believe that's the first time it specifically says that the healthcare insurance companies cannot spend more than 20% of the revenue on the marketing, administrations and other things, right? So you have to spend 80 to 85% of your revenue on healthcare. There's basically have to get the people's money worth for because the people paying the premium because they want to get their health care. So the government says that you should do that. So given that, you probably think that that would be a big blow for the healthcare for guys like UHC. Not really, because they figure out that a way to bypass it. So, for example, if we say if you limited the percentage of my money premium money on the healthcare, fine. Let me do something else. Uh, a lot of the things that they do is that the vertical integration. So they control the physicians, control the doctor's offices, and so they have everything under their control. They basically gain a lot of power during this process. But also, the other thing they did is that in the public sectors, they also integrated a lot of you know, Medicare Advantage and Medicaid, and those are public sectors. That's basically the money is paid by the government, the state government and the federal government. So these guys, they increase the enrollment for the Medicare Advantage, for the Medicare, Medicaid, and so let's just stop here.